Hello, welcome to the Opioid Epidemic and Veterinarians. First, let me introduce myself. My name is Taylor Bybee. I am a health education specialist at South Central Public Health District, and my primary focus is on drug overdose prevention, especially towards opioids. So basically, this slide just states that I am funded by the CDC so that I can do these presentations. However, the CDC gives me complete freedom on what I present. And so these presentations do not necessarily represent the official views of the CDC. So this is a chart that compares drug overdose rates on average between the United States and the state of Idaho. The solid line represents Idaho, and the dotted line represents the United States. As you can see, drug overdose rates have been increasing since 2000. In Idaho, the death rate has almost tripled since the year 2000. In the United States, the death rate is over triple since the year 2000. This graph represents drug overdose deaths in Idaho for the years 2013 to 2018. The dark-colored portion of the graph means a drug overdose occurred, but the type of drug wasn't reported. The middle number represents drug overdose deaths that were not opioid-related. The lightest color on the top represents opioid deaths. As you can see, the number of opioid deaths in Idaho has increased by about 50% since 2013. However, some experts believe that these numbers may be actually low. That's because the only coroner in Idaho that can examine bodies for cause of death is in Boise. So it's believed some opioid overdose deaths may be passed off as a non-specified drug overdose or may be passed off as a heart attack. For example, let's say a man in rural eastern Idaho took too many opioid pills and went to his bed and passed away. When the body is discovered, it may be passed off that the man died in his sleep or had a heart attack. The family may not want to pay the money to take the body to Boise to get it evaluated, so the cause of death is considered a heart attack instead of an opioid overdose. This graph represents drug overdose deaths in different areas in Idaho. Twin Falls and surrounding counties are considered Health District 5. As you can see, Twin Falls is a little lower compared to other health districts related to drug overdose and opioid overdose deaths. However, I still believe that these numbers are a little too high and could be better. What are prescription opioids? Prescription opioids are prescribed by a doctor to treat pain. Prescription opioids are used to treat moderate to severe pain, as well as short-term or long-term pain. However, prescription opioids have some risks. Prescription opioids can cause addiction. It is possible to become addicted to prescription opioids in as little as a week. Prescription opioids can also lead to overdose or death. You may think, well, just be responsible and follow directions and an overdose won't happen. However, it isn't always that simple. Let's say Grandma broke her hip and was prescribed codeine to help with the pain. One morning, Grandma wakes up and takes her prescriptions, including her opioid. Then Grandma has some breakfast and watches some TV. After an hour, Grandma still feels pain in her hip. Grandma decides she must have forgotten to take her pain pill, and takes another. Now this could be dangerous, and Grandma has a higher possibility of overdosing. Opioids can also lead to pregnancy complications, especially towards the baby. Sometimes using opioids while pregnant can lead to miscarriage. Also, the babies may experience withdrawal symptoms when they are born, and experience side effects such as crying a lot, inability to sleep, throwing up, and uncontrollable shaking. Opioids also have side effects such as sedation, which is sleepiness, constipation, and respiratory depression, which is a fancy word for slowing down of breathing. The reason an overdose can be deadly is because the opioid may slow down breathing or stop breathing altogether. The chart on the right is a prescription opioid list. It could be useful to be familiar with this chart, as sometimes not even doctors know different types of opioids. One of my friends had an ear infection. She went to the doctor because the only way to treat an ear infection is with antibiotics. The doctor wrote her 2 prescriptions. One was an antibiotic, and the other was tramadol, which is on the bottom of this chart. My friend knew tramadol was an opioid and said she did not want an opioid. The doctor did not believe he prescribed an opioid. My friend got the doctor to look it up on his phone to find that tramadol is an opioid. So it can be helpful to have this chart handy. Please feel free to take a screenshot of this chart or take a picture of the chart so you can reference it later. There are also illegal opioids. Illegal opioids include heroin and illicitly manufactured fentanyl. To give you an idea on how strong these opioids are, heroin is about 2 to 5 times stronger than morphine, and fentanyl is about 50 to 100 times stronger than morphine, depending on how each are made. Sometimes fentanyl is mixed with heroin to make it stronger without the knowledge of the user. It's also important to note that methamphetamine is not an opioid. It's actually a stimulant, similar to cocaine. As you can see, illegal opioids have the same risks as prescription opioids. This shows how similar they are. However, the risks are higher with illegal opioids because illegal opioids don't come with directions like prescription opioids. People who use illegal opioids use the amount they think they should use, which could be fatal. So you may be asking, well, how does this affect veterinarians? Well, more people are using veterinarians to continue abusing opioids since veterinarians may prescribe opioids such as tramadol, and may be easier to get opioids if a doctor refuses to prescribe an opioid. According to a survey, 73% of veterinarians felt their medical school training did not train them to prepare interacting with individuals with opioid addictions. Some people will even go to lengths of abusing their pets to get opioids. There is a story of a woman that had a golden retriever. She cut her dogs and took it to the veterinarian hoping to get opioids. However, the veterinarian realized the cuts looked very unnatural, so she called the police and the person was arrested. It is estimated that approximately 13% of veterinarians will encounter a pet owner with the intention to receive opioids to misuse, which is why proper training is needed. As well as people may go from veterinarian to veterinarian seeking opioids. This is also known as veterinarian shopping. Some people veterinarian shop because they are searching for a veterinarian that will give them opioids. Another reason people veterinarian shop is to get as many prescriptions as possible. I watched a documentary where a veterinarian took a job at an office about 30 minutes away from her old office. To her surprise, she saw a regular customer from the old office get prescription opioids for his pet. Turns out he was going to both for a while, getting opioids to abuse. There are multiple red flags that pet owners are abusing opioids and are trying to get opioids from a veterinarian. The first sign is a new patient. Obviously, not every first-time patient is trying to abuse opioids. However, a new patient may be veterinarian shopping to try to get opioids, so it would be beneficial to be wary. Another sign is a pet owner may say that their pet is hurting, but there is no evidence that the pet is in pain. If you tell them it doesn't appear the pet is injured and doesn't need a medication, they may say that the pet was in pain at home and may ask for medicine in case it happens again. Another red flag may be the pet owner asking for a prescription by name, especially an opioid. The most common that is asked for is tramadol. The pet owner may also ask for a large amount of medications. This may include asking for more so that they don't need to come back as often. Another red flag of abuse is the pet owner claims medications were stolen or lost, especially if it occurs multiple times. Another sign may be if a pet gets injured multiple times in a short amount of time, as the owner may be abusing the pet to get more opioids. In relation, there may be odd injuries that look unnatural. For example, the veterinarian that caught the pet owner in Tennessee with the golden retriever noticed the cuts looked very unnatural. The cuts were very straight and clean, which made us suspect the dog was cut with a razor blade. And the injuries did not look like it came from a fence or a different way. Finally, another red flag could be owning a large dog. Once again, I'm not saying everyone with a large dog is abusing opioids. However, those that abuse opioids tend to use bigger dogs, hoping that the higher dosage would be prescribed. So what can you do as a veterinarian to prevent opioid abuse? One way is that if you suspect veterinarian shopping is occurring, to let other veterinarians nearby know to protect them. Also, thoroughly check if the pet owner claims the pet is in pain to ensure that the medication is actually needed. Also, keep an eye on how often pet owners come in to or refill the prescription. For example, if you give a prescription meant to last 2 weeks and the pet owner comes in every week, it's possible the pet owner is abusing the prescription. Also, if you have reasons to believe someone is abusing a pet or opioids, it's important to call the police for the owner's and the pet's safety. Finally, keep medications locked in the building to prevent others from stealing it. It's also recommended to have a security camera as well in case anything is stolen. There are multiple resources available for those struggling with opioid addiction. One resource are doctors trained in medication-assisted treatment, otherwise known as MAT. MAT makes it easier for one struggling with opioid addiction to overcome the addiction and not experience severe withdrawal symptoms. There are also 24-hour crisis centers available in multiple locations in Idaho, including Twin Falls. There are also multiple recovery and support centers available as well. To receive more information, you can visit stopoverdoseidaho.org or call the Idaho Care Line at 211, or you can contact me as well. If you have any questions, then please feel free to contact me either through email or by phone. These are the references that I used for this presentation. Feel free to use them if you want to discover more information. Thank you for joining me on this presentation, and I hope you have a good rest of your day.